Get ready to invest in yourself and elevate your expertise with the Perio School podcast, brought to you by Perio School. It's Dr. Reena here, and you're joining us for a new monthly show where we'll be providing the latest case studies, first-hand insights, and interviews with our global dental network. Plus, we'll enable you to experience exclusive behind-the-scenes highlights straight from our global portfolio of courses. Let's get started. This season of the Perio School podcast is sponsored by Colgate. Register on Colgate's professional education hub to access all professional and patient resources, including your one-stop shop for all verifiable ECPD. Visit www.colgateprofessional.co.uk today to sign up and register. So in today's masterclass, we're going to be talking about diagnosis. Now, this is probably not the most interesting topic, but it is really, really important. As you may know, the classification was updated a few years ago, and it is a requirement now to be using this in practice. So there is no more chronic periodontitis, there's no more aggressive periodontitis. It's all changed. It's actually a lot easier now and a lot more simplified, and hopefully a lot more objective as well for our treatment planning. So I'm going to simplify in the next few minutes how you can come up with a diagnosis of the most commonly kind of thing that you're going to be seeing in practice of periodontitis. There's actually different types of periodontitis now in the classification. When you see the table, you can see there's also necrotizing periodontal diseases and also periodontitis as a manifestation of systemic disease. The one we're going to be talking about is just called periodontitis. As I said, there's no more chronic aggressive. So the most efficient way, I would say, of coming up with the diagnostic statement for periodontitis patients is by following these 6 steps that I've come up with. Of course, you can use the flowchart as well by the BSP, which is great. But of course, you then have to have the time to go through the flowchart as well. So this should be very, very quick once you get the hang of it. So the first step is really just determining, are they a periodontitis patient? And you do that by reviewing the available radiographs and checking for any bone loss, because the key thing is if they've got bone loss and the bone loss is due to perio, they will be labelled as a periodontitis patient regardless of their clinical status. So have a look at the radiographs, have a look at all the information you have, check for bone loss. If the bone loss is due to perio, they basically are a periodontitis patient. And this is key because you might think, well, what's the big deal? If they don't have pockets, if they don't have bleeding, why am I worried? Well, the thing is, once a patient is diagnosed as such, they are a periodontitis patient for life. They need to know that so they can keep up their supportive periodontal care and make sure that everything is under control, even if they are stable. But obviously, just make sure the bone loss is because of perio and not because of other things. Because remember, when you're doing things like surgical extractions, crown lengthening procedures, or sometimes other pathology as well, that can also cause bone loss. So once you've done step 1, you then, again, just continue to look at the radiographs, and you then go on to step 2, which is extent. So you assess the radiographs to determine the extent of bone loss. Remember, you're not using pocketing here. I've seen lots of examples where people think the extent of the disease is because of how many pockets they have and where they are. Actually, it's just, again, to do with bone loss. So how do you come up with the extent? Well, all you do is look at the information you have and see if the bone loss is localized or generalized. So if it's localized, that's up to 30% of teeth with bone loss. And if it's generalized, more than 30% of teeth with bone loss. So, you can really just by eye have a look at the radiographs and see what you find. There is one other option here called the molar incisor pattern. And this is less common, but this is when the first molars have bone loss plus or minus the incisors. In fact, this is almost like a replacement for what we used to call localized aggressive. So that's step 2. So step 1 was, is this a periodontitis patient? Give them that label of periodontitis. Step 2, have a look at the extent of the bone loss. Now what we do is step 3, which is staging. And we now zoom in to the tooth with the most amount of bone loss. And you've got to zoom in, even if one tooth has like 90% bone loss and the rest has 10%, you've got to go with that worst case scenario. So you pick that worst tooth and then you actually divide the root up into thirds and stage the severity of this bone loss. So are they stage 1? Stage 1 is early, mild bone loss. This is less than 15% bone loss or less than 2 millimeters measurement from the CEJ if you only have bite wings available. So that is stage 1, so very, very early disease. Stage 2 is moderate bone loss, so that's bone loss in the coronal third of the root. Stage 3 is severe bone loss, so mid-third of the root. And then stage 4 is very severe bone loss, which is the apical third of the root. So essentially, simplistic way is you divide the root up in the thirds, coronal, mid, apical, stage 2, 3, or 4. If a patient has actually lost a tooth because of advanced periodontal bone loss, you technically can just say they're a stage 4 patient if you know that. So that's step 3. Step 4 is all about grading. So now we have to think, okay, our patient has X amount of bone loss, but how quickly has that happened? Has it happened if they're 15 years old in 15 years? Has it happened if they're 90 years old in 90 years? That gives us an idea of the susceptibility of that patient. So staging was all about severity. Grading is all about susceptibility. So here you really have 3 options. Are they grade A, B, or C? The quickest way of working this out, of course, you can do the maths, but grade C is the bone loss more than my patient's age? The maximum amount of bone loss more than my patient's age. So you've got a 50-year-old with 80% bone loss. They're clearly susceptible. That's a grade C. Grade A is the maximum amount of bone loss less than half the patient's age. So you've got a 50-year-old with 10% bone loss. They're not that susceptible. That's grade A. Anything in between is a grade B. So far, to recap, we've done, are they a periodontitis patient? What's the extent of the bone loss? What's the stage? What's the grade? Now we're on step 5. So far, we've only really looked at radiographs and compared the bone loss against the age. Now we actually need to know, what are we treating? We don't treat bone loss, we treat pockets, we treat bleeding. So here you come up with the current disease status. So are they stable, in remission, or unstable? Stable is a healthy patient, no open pockets. Remission, again, still closed pockets, but you have more than 10% bleeding or 10%. So they're, in remission, disease is starting to progress, but no open pockets. And unstable is any pocket of 4 millimeters with bleeding or 5 millimeters and above. So it's quite a harsh classification. So that's your current disease status. And then the final step is really just tagging on any key risk factors. And these are essentially if they're a smoker or previous smoker, or if they're a diabetic. So you would add that on into your diagnostic statement. If you have other risk factors, technically, that needs to be a new line and you add on those as a separate statement. The diagnostic statement technically is just for diabetes and smoking. And that's really it. And I think once you practice, it can be super quick to come up with the diagnostic statement in your practice. So to recap, 1, is this a periodontitis patient? If they do, they have a label of periodontitis. Then what's the extent, localized or generalized? What's the stage 1, 2, 3, or 4? What's the grade, A, B, or C? Current disease status, stable, remission, or unstable? And then finally, any risk factors. I would personally make it easier for you in practice. Make sure you've got some templates set up. Make sure it's easy for you, and make sure that all the team are diagnosing and regularly also updating this diagnosis statement every time you see the patient. Okay, so in this segment of our podcast, I am very excited to speak to Dr. Shailesh Sharma. We've been, I guess, friends for a while. We've been referring for us for many, many years. And I thought it would be a good idea to discuss some cases with you and a little bit of background as you're kind of a practice owner. You've been practicing dentistry for many years. I think you celebrated a birthday recently, so I'm not going to ask the number, but you're very experienced, basically. But welcome to
Thank you.
the Perio School podcast.
Thank you. Thank you, Reena. Thank you for having me on this podcast. Thank you again for your birthday present the other day. It's always nice to be reminded of my age. I'm look forward to coming on here.
Amazing. Well, tell us a little bit more about your practice and the type of dentistry that you focus on.
So I'm fortunate. I've been in private practice for the last 20 years. I've got a strong emphasis myself on orthodontics. I'm an Invisalign Apex provider for the last few years. I'm a Londoner through and through, qualified from Guy's and St. Thomas's back in the day before they merged with King's. Went back there to study for a master's as well. And I think that's where I got my respect for further specialization. But the practice is relatively small. It's got 3 surgeries and a separate hygienist room. We have specialists for most fields, except for a periodontist and a pediodontist, which is what led me on my research for the best gum specialist in London. I found you initially on a friend's Instagram post. This led me to my first referral. I haven't looked back since. I was impressed with the way that my patients were looked after from the outset. And I mean, patients often speak about the patient journey as a cliche, but I mean, honestly, it was amazing to see how RW Perry put into action. So we've actually copied some of your protocols now, thanks to that. So
Amazing. I
uh,
actually didn't know that you came across us just from our an Instagram post. I've never asked you that, so that's good to know. So, as a practice owner, I think when you're choosing to refer for specialist care, I mean, what are some of the things that you look out for, and why did you particularly choose our clinic? I think it's important for listeners to be aware of because even when you're I almost think when you're a general practitioner, you want that network of specialists for every specialty, not just perio, you want it for endo, everything. So how do you develop that network and how do you find these people?
for me, it was word of mouth. I mean, in the old days when I first qualified, specialists were few and far between. So in your locality, you had one or two specialists, and that was it. Nowadays, particularly being in central London, there are lots of specialists. But again, among specialists, there are specialists, and then there are specialists. So word of mouth goes a long way. Speaking to my peers, and then networking. So you do dentistry is a very small world. So just going to open days, seeing practices, doing practice visits, meeting teams personally, I think
Yes.
goes a long way. So and that's where you get a feel for the practice. Qualifications and everything can only tell you so much, but the rest of it is what you see and experience.
I completely agree. And I remember when I first graduated, actually going out there and meeting people in person, I think is so important because at the end of the day, whoever you refer to, it's like an extension of your care, right? So we want the patients to feel like you're just part of this extended team. So you've got to get to know people. You want them to be, available at the end of the line where you can just give them a call if you've got questions about a patient and you're kind of all working together. So yeah, completely agree with that. You've obviously referred lots of patients to us over the years, but can you think of an example of a case where, referring to a specialist really made a difference to your patient?
Um, I mean, touch wood, I've been very lucky. Most of every of my patients, when they come back, they love going to you, which I get serious FOMO about. But one particular case, I remember there was this mother of this daughter who was getting married, and the mother, unfortunately, she had a nasty accident before the wedding. She needed some quite extensive restorative work, but I couldn't start it unless I knew the periodontal status was healthy. So I remember referring to RW Perio, and they were brilliant because the mother was very nervous. She was stressed about the wedding and everything else. You guys looked after her, like as if she was family. That the outcome ended up very well for everyone. So I was very impressed with that whole situation because it wasn't just managing the actual mouth, but it was just managing the patient as a whole while she was going through a major life event, which I thought was brilliant. And I think that that was a what made you stand out. So I remember that. Thank you.
No, thank you. Do you feel like sometimes referring to a specialist helps build that trust with your patients then overall? Because people always worry if I'm going to refer to a specialist or out of the clinic, that the patient's not going to be looked after in-house. They may lose the trust with the care. Or what experience have you had with that?
So again, going back to what you said earlier, is like when I refer out, when it represents me, so it's an extension of my care. So um, I for because I've been there myself, because I've witnessed firsthand the treatment. When I refer, I actually can refer with full confidence, knowing exactly what the patient's going to go through. Um, so I think it's a very smooth, it's very easy. Basically it's a no-brainer when I'm referring. You know.
Yeah, I mean, the other thing as well is with perio, people often think, oh, I'll just send it to regardless of the severity. I'll just send it to the hygienist. They'll do a quick clean, and then I can crack on with my restorative or ortho work. But I guess from the cases that we've seen, you've sent us some quite severe cases as well. I think managing the periodontal condition properly only puts you at an advantage afterwards because you can then do good, predictable restorative care. Your ortho is going to work. It's going to last. Have you felt that? I mean, why do you think people don't send to the specialist when they need to? What do you think the barriers are, and how did you realize that you do need to refer?
I think there are a few factors. One is if the dentist or the hygienist is not honest with the patient from the beginning, saying, look, this is your situation here, but it's a very fluid dynamic situation. And if they have been monitoring the patient for a long period of time and then all of a sudden by going on a course or by finding out from somewhere else that the patient then needs a referral to a specialist, then you have to have that awkward conversation with the patient that, oh, and the patient can turn around with all with all due respect, they can turn around and say, look, well, why didn't you refer me earlier? So I think
Yeah.
there is that sense of, oh, let's just keep it going. At some point, it'll get better. So we like to have conversations early with our patients and look, you know what, this is the situation here, but at any point in time, if things don't go the right way, we will be referring you. And that way there, you eliminate the surprise. And I find in dentistry, there's no such thing as a good surprise. The other thing,
Yeah.
obviously, there is a financial implication, but these days here, patients are very happy to invest in their oral health, and it's not as expensive as it used to be. So I think that hurdle there is, I don't think that counts that so much now. It's just more of information to the patient.
Yeah, completely. I think definitely the point you said about sort of planting the seed initially is really important so that even if you don't refer straight away, you can say, look, I'm going to do one round of treatment, or my team's going to do one round of treatment, see how you go. If it doesn't respond well, then we will need to refer. So you've already planted the seed. So as you said, it's not like a big surprise. I guess one of the benefits of perio is that it's a condition where it does go up and down. So, you can say to the patient, what you found today is particularly severe for whatever reason, and now you'd like to instigate referral. So you do, luckily, with things like Perio, you do have that kind of backup. But if you miss caries, you miss caries. That's it. So with Perio, you can do that. But I think, yeah, I agree with the affordability side. I think also nowadays, a lot of practices have finance options that are interest free. When you look at the comparison, like if you lose a tooth, especially with Perio, if you lose a tooth, one implant is like £3,000, and most of our treatment plans will never go over like 2.5K. So, and that's for the whole mouth, not just one tooth. So I think it's about, as you said, that communication, that conversation with the patient. So you've also experienced treatment with us as a patient. What was that like? I've never got a chance to ask you. How was your experience with us, and going in from a patient's perspective?
Well, let's just say that we're still friends now. Okay, so the experience was the experience was a pleasant one. Um, I mean, believe it or not, honestly, I'm actually a very nervous patient myself. Okay, so my nurses will testify to that and mock me many a time. But when I came to see Shehnaz, she was really pleasant. It was something that I was put at ease right from the get-go when I walked in. You felt very comfortable. You felt very safe. So I'm actually looking forward to my next appointment, which is great. I actually liked it so much. I referred my mum to your team for
Yeah.
periodontal treatment. And you know what Indian mothers like, they're very critical. But she was glowing. Okay, she was like very I'm still in her world, so it was a good thing. So no, I've loved it. I always like coming to 75 Harley Street. It's a very pleasant experience.
And how do you find the communication? Because I think a lot of the time, I think when I first set up the clinic around 8 years ago, one of my friends said to me really clearly, make sure your communication is good. Because sometimes when you refer patients to a specialist, you have no idea what's going on. You don't hear back from them. You don't know if they've been booked in. And it's just, not great for the referrer. How have you found our communication, and why do you think that's important?
So, as I refer to quite a few specialists, I think your communication, your whole team, it's your USP. Okay, it makes you guys stand out from everybody else because I I love the fact that from the moment I refer, I get an email, I get confirmation straight away that the patient has been contacted. I know what the patient's doing at the same time that the patient's doing it. I love the fact that I get updates on the progress. I love the fact that I get some advice at the end for ongoing treatment, what the patient's been told afterwards, after the course of treatment. So it's just not just forget about the patient anymore. We're constantly doing that. I honestly, that for me, I know that the patient's in safe hands, and if the patient's in safe hands, then I know that I'm in safe hands.
Yeah.
And communication is key. So I really like it.
And how, I mean, just reflecting now on the many years that you've been referring and we've been doing joint up cases, how do you think, like in the future, specialist collaboration fits in with the future of dentistry? Do you think it's going to be an important part? Or what's your thoughts on that?
So my cliche is I think the future is already here. Okay, dentistry, it's multidisciplinary. We can't just treat the gums in isolation. Can't just treat the tooth in isolation. I find that being an orthodontist, my treatments are much more successful if everything else is healthy at the same time, which is why, liaising with all my specialist team, liaising with you, treatment is so much better. So it can only improve. It's a no-brainer again. You
Yeah.
have to. In these days, you have to. So
I
that's a
guess
good
the
thing.
other point is that medical legally, I don't know if everyone knows, but perio is at the top of the list when it comes to litigation. So it's the one specialty that you really want to be careful that you're diagnosing, you're referring at the right time, you're, as you said, telling the patient their diagnosis, making sure you're being honest with them about when they need referral. So I think it's, I know we don't want to be having to worry about defensive dentistry, but you've got to be careful, I think, with perio for sure.
I mean, completely. It's like whenever we see new patients, existing patients, touch wood, we're fortunate. They're well motivated, they're on board, they know exactly what they're doing. But new patients, they're our biggest worry, because when we see patients who've had supervised neglect before, and then you have to have a conversation with them about why they were not treated earlier and why they're now being referred to a specialist. It's upsetting for the patient, which is not good for anybody. So no, I completely agree. It's in this day and age, you have to be on board with all of that. And patients are much more savvy. There's a lot of trial by social media. They will be looking out there. They know what's going on. So you have to be on top of your game.
Yes. Well, one last question. What does a great referral relationship mean to you? What does it involve?
Knowing that you and your team are literally at the end of the phone. I can contact you via email, via WhatsApp, via calling. Just knowing that you're there. I don't have to refer just for complex treatments. I can refer literally for a second opinion. Before I'm starting some treatment. I love the fact that your team treat my patients the same way that I would like to treat my patients. So it's one big umbrella. So that is, for me, that's a perfect relationship.
Amazing. Well, listen, thank you so much for your time. I know you are busy in between lunch, so we'll let you get back to your patients, and we really look forward to continuing to collaborate. So, thank you so much, Sailesh.
No, it's been a pleasure. It's been a pleasure, Reena. Thank you very much, and look forward to working with you again.
Hi, Perio School here. Today we are working with our hygienists who are doing a diploma in periodontics. They will be done in 2 months, and we really wanted to hear their feedback, how their journey went, and were there any points they would like to share with us.
Hello, my name is Kelly. I'm a dental therapist. I qualified in Leeds in 2018 and I'm currently working in general practice treating all age ranges with therapy and hygiene. I signed up to the Perio School Diploma because I just wanted to clarify my knowledge, and obviously things had moved on with the S3 guidelines, so I wanted to make sure I was doing the right thing for my patients when they attended. I feel like I've learnt so much. I felt like qualifying, I knew what I was doing, but now I definitely know what I'm doing. And I feel like I can give patients the right treatment to make sure that their gum disease will become stable, and then they will become my maintenance patients, not my returning perio patients. Reena's really engaging, and everyone at the dental school is really supportive and helpful. If you've got a question, they'll answer it. We have a WhatsApp group, and all the other girls on the course do help and support each other. So being the only hygienist and therapist in my practice, I feel like I've just got a whole family of support now behind me. So to anyone who's debating whether they want to do it or not do it, I would say 100% go for it. You literally become part of a family, and you're never going to get that anywhere else.
Hi, my name's Shannon. I'm a dental therapist based in London and in Dorset. I'm mainly based in private practice, but I also work in a prison. I currently work at 7 practices, which is soon to change. I was really worried when I took on the postgrad diploma that it wasn't going to fit around my work, but it's actually slotted in really well, and I really look forward to the study days every month. I started this postgrad diploma because working in central London, it can be quite competitive, and I really wanted to stand out. But it's really given me a new lease of life for treating perio. It's something that I really look forward to now. And yeah, I love getting stuck in on some of these juicy cases. So yeah, really enjoying it, and definitely something I think everyone should get involved with.
Hi there, so my name's Lauren. So I am an oral health therapist from New Zealand. So I have dental hygiene and dental therapy within my scope, and I qualified in 2019. And I've moved here to the UK to do Reena's course because back home in New Zealand, we don't have offerings of extra training. So it's really nice that Reena recognises this, and she also has the diploma over in Australia now as well. So she's recognising that niche market that we have, and we get to offer extra training. So basically we can offer better treatment to our patients as well.
I'm Ione. I'm a dental hygienist working in London. The reason I decided to do the course was that I'm the only hygienist at my practice, and there's also not a periodontist there. So I just wanted to make sure that I was providing the highest standard of treatment possible and that I knew everything that was needed for all of my patients, whether that be treatment with myself or referral. Since doing the course, I feel that my confidence has improved massively and that my care has improved for my patients as well.
Fantastic, thank you. These were our wonderful hygienists who are doing our diploma in periodontics, and they are about to finish in 2 months. So we really wanted to hear their feedback. So if you are considering to do diploma, you can hear about their journey, what they were doing, and how happy they are with the diploma. Thank you.
We are so excited to welcome into our quickfire My Dentistry Life Q&A Filippo Graziani, someone with such an inspiring blend of academic excellence and creative vision. Filippo is a full professor of periodontology at the University of Pisa, an honorary professor at the University of Hong Kong, and a visiting professor at University College London. With a specialty in periodontology from the prestigious Eastman Dental Institute at UCL, his work bridges latest science and clinical excellence. Beyond academia, Filippo is the founder of Perio Campus, a fresh, innovative approach to periodontal education, and editor of the Perio Campus Herald. He is also running Paro Centro, a dedicated periodontal clinic built around his own clinical protocols. Filippo launched Be Queen 33, a startup that supports dentists around the world in building effective communication and marketing strategies. Filippo, a warm welcome to the Perio School podcast.
Hello, Reena. What a great pleasure being here, actually. Very unexpected and very happy to be with you.
Oh, thank you so much for your time, and congratulations on everything you're doing and everything you've achieved. It's so inspiring.
Well, as you know, it is just the amount of time that one devotes to the things. So it's nothing special. It's just that I destroyed my life for many years to achieve things that are kind of empty medals. But now I love to look at them, but I'm very happy to do other things, I have to say.
Amazing. So let's find out a little more behind the scenes of your day-to-day life. So we'll kick off with the first question is, how do you start your day? What is your any kind of like non-negotiable daily habits for the morning?
Mm-hmm. Well, I have to tell you that I am not a consistent person. I'm not regular. So I go on fashions. To give you an idea, I have my 3 months where I have to meditate every day. Then I get bored, and then I move to journaling. So I do journaling for 3-4 months. Then I get bored again. So I kind of move and swap and try to be very holistic and to try to apply all the things that you might hear in any possible podcast related to personal development and so forth. But I change. As I told you, I'm very inconsistent. But there is just one thing that I have to do every day, which is to do weight training. If I don't
Okay.
do some training, I have to say become kind of aggressive towards people in general, and I like to do it in the morning. So the feeling is you do something for yourself. So now I can devote I can devote my persona to the word, but I have to, yeah. And afterwards I have breakfast.
And what do you normally eat for breakfast in the morning?
It's very boring. It's two things really. I have one type of breakfast which is really scrambled eggs and avocado and
Yeah.
whole grain bread. I'm kind of fixated with good bread and good pasta, with good flours, usually whole grain, bio flours, and so forth, for a number of reasons that I'm not going to go through that. But anyway, and then actually, I know it's very unexpected, but I drink herbal teas.
Okay.
When I lived in England too long, I have to tell you to leave coffee away from my dietary habits. Of course, I'm talking about 20 years ago. Now you can drink amazing coffees in London, but in 1999, 2000 wasn't really the best coffee ever. So I started to drink teas and I got used to that. So nowadays I don't drink not even teas because I don't sleep. So I feel them. I feel caffeine very much. So I just drink chamomile and herbal tea. It's very boring. That's what I do. Or vice versa, I just have some turkey ham and peanut butter. It's one or the other. I mean,
One or the other, and that gets you going for the day. And then what's the first thing you do when you get into the office, when you get into work? What's the first thing that you do to start your work day?
Well, I have to tell you, my week is very diverse. On Monday, I'm like today, I'm all day in my company, so we're sorting out various issues related to perio communication or perio patients in the practice that are joined the networks. On Tuesday, so Monday, of course, I'm going to the company that is a different building from my practice with other employees and other friends that are working. So, and it's very, how could I say, it's very meeting based, open space kind of vibration. So it's more, I jump in, I'm always late. Every day I'm late. I'm not a regular person. I mean, I'm an owl. So I get very late and I start to talk with anybody, interrupting them when they're working so that you can understand how much they might like me. On Tuesday, I go to the university. So I'm late, so I have to rush to give lectures. And then Tuesday afternoons, I'm with my daughters because it's my time with my daughters. Then Wednesday, I'm seeing patients all day. And I start very early from 8 till 8. I do 12 hours because it's just really one day per week. So I have to do crazy things. And the first thing that I do, I usually get upset when I get into practice. I don't know why, but I always have to complain about something. But then we get going and then I have fun all day. And then usually Thursday and Fridays is for courses or congresses. So I'm always traveling. So every day I have a different start. The only thing that I try to keep consistency is really the physical training and my breakfast at the moment with myself.
Brilliant. What a diverse week. You got to keep your energy up for sure. When you're in the clinic and you're seeing patients, what's your favorite treatment that you like to perform?
Well, I have to tell you, there are two, but I also have to say these are the only treatments that I do nowadays, which are the examination and treatment plan and the surgical aspects. All the rest now is dealt by teams, really. And my favorite surgery, for example, is reconstructive surgery. It's something that I enjoyed it very much all the time, especially when I start to rebuild the anatomy. I love it much more than mucogingiva, for example, which I found nice because you really see the before and after. But maybe sometimes I don't know, it doesn't give me the same vibration. So I'm kind of fixated with regeneration.
And is there a tool or gadget that has changed your workflow recently? Like any tech because I know you're very high tech, any tech that you always rely on?
Well, very much so. I actually built myself a software which is called Perio Mind, and I've started to use it 1 month ago in my practice, and allows me to cover all the aspects of perio.
Okay.
So now I'm very excited because, as you can imagine, it being version 1.1 has so many mistakes, so many troubles on a daily basis. But I'm getting very excited because it is really structured according to my protocol, according to what I do. So it's a track to follow a path really on the patient journey. As you know, being periodontists, we have to ensure that the patient is followed up throughout life, which is one of the most complicated things ever, not just in terms of clinic, but also in terms of communication. So this is really the biggest tool is the software. Plus, I've always worked with microscopes, I have to tell you, and to the point that I have to confess sadly that without it, I can't even work anymore. Without loops or microscopes, I'm getting old. I don't see that well anymore.
What magnification do you normally work at for kind of reconstructive surgery?
I use microscope, but I use usually 16 times.
Wow.
Usually 16 times, between 10 and 16. I usually swap to 10 for video recording because 16 is a bit too focused for videos. So I think as yourself, you have the same issues, that it's not just about treating patient, it's also about taking the right
Yes.
amount of, let's say, visual production
Yeah.
for courses and congresses. So I swap between 10 and 16 times. Whereas when I'm using loops, I'm usually I use something very small, like 2.5, 2.8. I don't use the
Okay.
4.5 or the very tricky one.
Fine. And every time we meet, you're very motivated, full of energy. I'm curious to find out, what inspires you? What keeps your energy up? Is it a certain person? Is it a book you read? Is it a ritual you do? Like, what keeps your energy and motivation high?
Well, first of all, as you can imagine, I think like many others, I'm just having fun. And I try to think as much as possible out of the box. I kind of
Yes.
get frustrated when I see fashion, when I see people always going in the same direction. I always try to find something different. And I found out that you can be erratic and you can be really the black sheep as long as you smile to everyone and you're kind. People will let you do it. So this is really maybe what you saw as a sort of motivation was just me being very polite to try to do exactly what I feel I should do, irrespective of the others. But the bottom line is that I turned 50, and when I was 46, I decided to change my life. So I made some important decision, and I cannot waste my time uh, to reach my happiness. I mean, my full goal is dedicated to that. There's no discussion.
I love it. I think that's a very important goal. Interesting question. What's one thing that people might be surprised to learn about you? Any kind of guilty pleasures? Anything that we may not know about you?
Okay, well, there are so many flaws to say, I have to tell you. But well, I think first of all, I don't like periodontists in general. It's the first thing that we're going to say. I tend to think that periodontists are kind of too precise. I mean, I'm very picky. I'm not that picky at all. I'm somebody that is very how could I say? You could meet me for a beer with friends, and you'll see I'm my best. So I love people. I adore people next to me, and I do eat a massive amount of Nutella. So any possible of
Really?
nut cream is something that even when I'm in the strictest diet or nutrition for training, whatever, if you pass this in front of me, I would corrupt anyone just
Oh,
to
wow.
try it. I mean, it's something I I mean, of course, these are all the legal things that I can say. Then there are many other things that I cannot say in a public podcast, but this is really the thing that motivate me the most.
Love it. We know what to buy you now when we need a gift for you. And you're very good in when you're doing your presentations, when you're in front of the camera. I know we've done some socials together and you're always ready to record a video. What would be your best tip in terms of being in front of the camera? What's really helped you give you that confidence?
I know that's not very helpful, but I have no methods whatsoever. I mean, it's not something that for me is very important is never do rehearsal. Every time that I did any sort of rehearsal, when I'm in front of a camera, I just give my 60%. I get, perhaps because I get bored of myself listening to
Right.
things more than once. Perhaps you don't have the kind of adrenaline energy of the little unknown things, even the fact that whether you would be able or not to perform. So I try to follow a flow, and at the same time is to be a bit scared. So that gives me really the pump.
Makes sense. And when you're not working, what's your ideal kind of spot to unwind? What do you do to just recharge?
Okay. I actually, with the years, I got fixated with gardening, and I adore
Oh,
to be in the
really?
garden or to walk in the bushes. I'm very Italian. I'm full Italian, but I don't necessarily enjoy the beach that much. I mean, I go there all summer because I enjoy the sun, friends, and so forth. But if I would have to choose between, a forest in the mountains or going to the beach, I would definitely go in the forest. Of course, in a
Right.
spa on a forest on a mountain, not necessarily on a manier, but yes, I enjoy to be in nature. I love it. I love it very much.
Nice. And any favorite podcasts you're listening to at the moment, or any books that you're reading that you're
Yeah,
really enjoying?
I have to tell you, I've been fixated for many years with Alex Huberman podcast,
Mhm.
which I adore. literally I'm taking notes sometimes.
Right.
And then even Jay Shetty, it's
Yes.
another one
That's
that I listen to, and another one which is the Diary of a CEO, with
Yeah.
Stephen Bartlett.
Mhm.
These are three very famous ones, but these are the ones that I normally listen to when I'm driving, and I enjoy them very much. As I told you, I literally take notes sometimes. But I also have to confess that I never read any of the notes I take in my life. But I like the fact that I'm writing.
Yeah. No, I do the same. I write them and then I never look back. But it sometimes helps you to remember them when you're writing them out. So yeah.
Absolutely.
If you weren't in this profession, if you weren't a periodontist and you're also entrepreneur, what would you be doing, do you think, if you weren't a periodontist?
Well, I think I would have devoted myself to entrepreneurship earlier on because I started
Mhm.
very late, I have to tell you. But perhaps I would go into, I think, perhaps economy or law, let's say, type of job where actually the use of your word and or your speech and communications are
Yes.
really sort of fundamental, like milestones of your pillars of your career.
Mhm.
Because for me, communication is fundamental. I mean, everything is about communication. Even our job is entirely
Yes.
related to communication. So it's something that comes very natural to me, and I adore it. I read, I enjoy it. I love any possible form of communication. So I think I would have done something like that. In fact, I often wondered in my life, why did I become a dentist?
Oh, well, it's not too late. And it's great to see all the additional things that you're doing, all absolutely brilliant business ventures. So, yeah, I have a final question for you. If you're now looking back, to your life so far and giving advice to your younger self, what would you say to, younger Filippo? If now you've told us your age now, so we can say you're 50 and you're looking back. Any particular quotes or anything that you would say to finish?
Well, that's a very nice question, but I think the only thing that makes sense is something I truly believe that I tell to my daughters all the time,
Yeah.
to listen to oneself very carefully, to try to really understand what are really your true needs and motivation, and don't taking yourself too seriously. I mean, don't follow your brain too much, and
Mhm.
really try to see what you really need. Because I realized that the majority of my choices in my adult life were driven by the idea that I had my life should have been, and not what I really wanted or felt it. I wasn't
Right.
really listening to myself. So yes, no hesitation. Is examining oneself very carefully before taking any decision.
Love it. I think that's very wise words. Filippo, listen, thank you so much. I know you're back to back with meetings, so very much appreciate your time. Very inspiring, and I'm sure all of our listeners have really enjoyed it. Where can we find you? What's your Instagram? Where's the best place if we want to find out more about what you're doing?
Well, I wouldn't give all my professional accounts. I would just give the personal one because for me, it's the only thing that matters nowadays, which is Instagram. The Fili Graziani on Instagram is really my
Great.
real life. Everything is there.
Wonderful. Thank you so much, and I'm sure we'll speak again soon.
Thank you, Reena. Good
Thank
luck for
you.
all your things. It's
Thank
amazing
you. Thank you.
to see what you do. Bye bye.
Thank you.
This season of the Perio School podcast is sponsored by Colgate. Register on Colgate's professional education hub to access all professional and patient resources, including your one-stop shop for all verifiable ECPD. Visit www.colgateprofessional.co.uk today to sign up and register.